Research shows that there are more than 850,000 people in the UK who have dementia. 1 in 14 people over the age of 65 have dementia, and the condition affects 1 in 6 people over 80. Furthermore, the number of people with dementia is increasing because people are living longer. Therefore, we at MedicMe feel like it was important to spread awareness of this disease. Alzheimer's disease is the most common type of dementia in the UK. Therefore, we will be predominantly talking about Alzheimer's in this video.
What is dementia? Dementia is a syndrome, a group of related symptoms associated with an ongoing decline of brain functioning. It can affect memory, thinking skills, and other mental abilities. Alzheimer's disease is a specific type of dementia, which exact cause is not fully understood, but a number of things have been identified, which are thought to increase the risk of the disease.
Symptoms. The symptoms of Alzheimer's disease progress slowly over several years. Therefore, these symptoms can sometimes be confused with other conditions and may initially be put down to old age. However, the rate at which these symptoms progress is different for each individual. In some cases, other conditions can be responsible for symptoms getting worse. These conditions include infections, stroke, and delirium. As well as these conditions, other things, such as certain medicines, can also worsen the symptoms of dementia.
Stages of Alzheimer's disease. Generally, the symptoms of Alzheimer's disease are divided into three main stages. Early symptoms. In the early stages, the main symptom of Alzheimer's disease is memory lapses. For example, someone with early Alzheimer's disease may forget about recent conversations or events, misplace items, forget the names of places and objects, have trouble thinking of the right word, ask questions repetitively, show poor judgment or find it harder to make decisions, and become less flexible and more hesitant to try new things. There are often signs of mood changes, such as increasing anxiety or agitation, or periods of confusion.
Middle stage symptoms. As Alzheimer's disease develops, memory problems will get worse. Someone with the condition may find it increasingly difficult to remember the names of people they know and may struggle to recognize their family and friends. Other symptoms may also develop, such as increasing confusion and disorientation, for example, getting lost or wandering and not knowing what time of day it is. Obsessive, repetitive, or impulsive behavior. Delusions, believing things that are untrue, or feeling paranoid and suspicious about carers or family members. Problems with speech or language, aphasia. Disturbed sleep, changes in mood such as frequent mood swings, depression, and feeling increasingly anxious, frustrated, or agitated. Difficulty performing spatial tasks such as judging distances, or seeing or hearing things that other people do not. These are hallucinations. Some people also have some symptoms of vascular dementia caused by reduced blood flow to the brain. By this stage, someone with Alzheimer's disease usually needs support to help them with everyday living. For example, they may need help eating, washing, getting dressed, and even using the toilet.
Later symptoms. In the later stages of Alzheimer's disease, the symptoms become increasingly severe and can be distressing for the person with the condition, as well as their carers, friends, and family. Hallucinations and delusions may come and go over the course of the illness, but can get worse as the condition progresses. Sometimes people with Alzheimer's disease can be violent, demanding, and suspicious of those around them. A number of other symptoms may also develop as Alzheimer's disease progresses, such as difficulty eating and swallowing, called dysphagia, difficulty changing position or moving around without assistance, weight loss, which can sometimes be severe, unintentional passing of urine, called urinary incontinence, or stools, called bowel incontinence, a gradual loss of speech, and significant problems with short and long-term memory. In the severe stages of Alzheimer's disease, people may need full-time care and assistance with eating, moving, and personal care.
Causes. Alzheimer's disease is thought to be caused by an abnormal buildup of proteins in and around brain cells. One of the proteins involved is called amyloid, deposits of which form plaques around brain cells. The other protein is called tau, deposits of which form tangles within brain cells. Although it's not known exactly what causes this process to begin, scientists now know that it begins many years before symptoms appear. As brain cells become affected, there's also a decrease in chemical messengers called neurotransmitters, involved in sending messages or signals between brain cells. Levels of one neurotransmitter, acetylcholine, are particularly low in the brains of people with Alzheimer's disease. Over time, different areas of the brain also start to shrink. The first areas usually affected are responsible for memories. In more unusual forms of Alzheimer's disease, the other areas of the brain are affected where the first symptoms may be problems with vision or language rather than memory instead.
Risk factors of Alzheimer's disease. Although it is still unknown what triggers Alzheimer's disease, several factors are known to increase your risk of developing the condition. These are age. Age is the single most significant factor for dementia. The likelihood of developing Alzheimer's disease doubles every 5 years after you reach 65. However, this causes there to be the misconception that only the elderly can get dementia, which is untrue. This is shown by how around 1 in 20 people with the condition are under 65. This is called early or young onset Alzheimer's disease, and it can affect people from around the age of 40. The second risk factor is family history. The genes you inherit from your parents can also contribute to your risk of developing Alzheimer's disease, although the actual increase in risk is pretty small in most cases. However, in a few families, Alzheimer's disease is caused by the inheritance of a single gene, and the risks of the condition being passed on are much higher. Therefore, if several family members have developed dementia over the generations, and particularly at a young age, it is advised to seek genetic counseling for information and advice about your chances of developing Alzheimer's disease when older. Down syndrome. People with Down syndrome are also at risk of developing Alzheimer's disease. This is because the genetic fault that causes Down syndrome can also cause amyloid plaques to build up in the brain over time, which can lead to Alzheimer's disease. Next, we have head injuries. People who have had a severe head injury may possibly be at a higher risk of developing Alzheimer's disease, but much research is still needed in this area. And finally, we have cardiovascular disease. Research also shows that several lifestyle factors and conditions associated with cardiovascular disease can increase the risk of Alzheimer's disease. These include smoking, obesity, diabetes, high blood pressure, and high blood cholesterol. You can help reduce your risk by stopping smoking, eating a healthy, balanced diet, leading an active lifestyle, both physically and mentally, losing weight if you need to, drinking less alcohol, and having regular health checks as you get older. Thank you for watching the first part of our Alzheimer's disease series. Since some of our members are dementia friends, we decided that it would be important to have a longer 2-video series to spread awareness about this disease. We will also be regularly posting from today again. Make sure to comment and subscribe for more videos in the future. Make sure to follow us on our socials and check out the blog down below. Once again, thank you for watching.